What's going on, everyone? Brad Logue here, owner and physical therapist with Top Tier Physical Therapy in Middletown, Delaware. And this video, we're going to go over a not commonly thought of structure that could be contributing to some kind of medial knee pain or pain on the inside of your knee. The structure we're talking about today is called the pes anserine. It is a group of 3 different tendons that all run down and insert onto the inside part of my knee, just next to and below my kneecap. So we have the sartorius that's going to run across my hip down to the inside of my knee, the gracilis, which is going to start in my groin and run down the inside of my thigh into the knee, and then the semitendinosus, which is one of my hamstrings that will start in the back of my leg and run anteriorly again into the inside of that knee. All these tendons come together and they form the pes anserine, and there's even a little bit of a bursa underneath those tendons just to help cushion it between the nearby bone, the tibia there. These are muscles that are hip extensors, hip adductors, knee flexors, so very involved with movements like hinging or deadlifting, RDLs, even squatting, and then of course some kind of twisting, running, jumping, or cutting. So a lot of the times the medial knee pain, the blame gets put on the meniscus, it gets put on the MCL, sometimes even the kneecap, which are very well possibilities for someone having medial knee pain. But these are 3 structures, the sartorius, the gracilis, and the semitendinosus, that could also be contributing to knee pain and may not be getting addressed as much as they need to be if we're focusing primarily on the quads. So knee pain, quads are king. You're absolutely going to be strengthening the quads if you're dealing with some kind of knee issue. But we don't want to forget some of these other stabilizing muscles like the ones involved in the pes anserine. So we're going to go over a couple exercises here where you can target those muscles a little bit more specifically and use this as a little bit of a trial and error to see if, as I work on these muscles, is my pain improving. If that's the case, then there's a good chance that this pes anserine is what's a contributing structure to your pain. With these exercises, we're going to go after the primary movements that these 3 muscles perform, which is going to be the hip adduction, the knee flexion, and a little bit of hip extension. I'm going to try and keep these exercises simple. That way, it's more likely you're going to have these pieces of equipment either at home or at your typical gym that maybe doesn't have all these fancy pieces of equipment. So for the first one, we're going to target the adductors, probably more of the gracilis here. Just think of it as the movement, not necessarily the specific muscle that you are targeting. So we're going to get the band nice and low on our ankle. I have it fastened to my rig. You can tie it to something that's not going to move. And we're just going to go through resisted hip adduction here. So I'm pulling the swinging leg into my midline or towards my other foot and trying to be consciously aware of squeezing through the inside of my thigh here. If you're doing this and you're reproducing some of that medial knee pain, could be an indicator that this structure is contributing to your pain. So just a band for that one. The next one, we don't really need anything. If you've watched some of my videos in the past, you may recognize this exercise, just a single leg RDL. So now we're going to work more on that hip extension, knee flexion, where we're targeting a little bit more of the semitendinosus, but again, just thinking of the specific movement, not the specific muscle. So standing on one leg, a little bit of a bend in that stance leg, and I'm hinging over as my chest falls to the floor. My swinging leg is coming up to the sky. So if I show you from the side, my trunk and my leg all stay in a straight line as I go down. And again, if you're starting to feel some of that familiar inside knee pain, good chance that this pes anserine is contributing to the pain you're experiencing. So now if we want to combine these 2 movements and kill 2 birds with 1 stone, what we can do is take a band, maybe a little bit stronger of a band than we use for the hip adduction, tie it up against something that's not going to move, like a rig, and we're going to go through an RDL here. So the band is facilitating that hip adduction, so the band's trying to pull my knee out. I'm squeezing my adductors to keep the knee in, kind of aligned with my big toe, and then I'm going to go through a single leg RDL on that banded leg. So I'm working through hip extension and some isometric knee flexion while keeping my adductors activated by having the band try and pull my knee out. So if you're pressed for time, and you want to kind of kill two birds with one stone, that's a way you can work on hip adduction and some of the hamstring at the same time. All right, moving on to trying to isolate the hamstrings a little bit. We're just going to keep it simple and go through a seated hamstring curl. So at some of your gyms, they may have a machine for this, either sitting or laying on your stomach and doing a hamstring curl. Both of those are great options for this. If you don't have access to those machines, simple way you can do this at home is if you have a bench and a band, tie the band to something that's not going to move, wrap it around your ankle, and now you have your modified hamstring curl. So letting that band pull the foot out and then squeezing the hamstring to pull my heel back towards my butt. So thinking of squeezing the underside of my thigh to bend that knee. Something you can do to maybe try and isolate, if you will, those medial or inside hamstrings is going to be to turn the foot in and go through the hamstring curl that way. So instead of toe pointing up towards the sky, I'm going to turn my foot towards my other leg and go through a curl that way. And that may help load a little bit more of that medial hamstring, that semitendinosus, which is what's going to run down into the pes anserine. So those first movements were more focused on forward and backwards or moving through the sagittal plane. For this last one, we're going to switch it up and be more side to side or in the frontal plane, just to hit as many different components for this pes anserine pain as we can. So for this one, you're going to need something that'll help your foot slide. So on the turf, these furniture sliders work pretty well. Furniture sliders will work great on carpet. You could also use cardboard on a carpet or a paper plate. And then if you got something like hardwood or tile, just a sock or a towel will work fine. Pretty much the only surface you won't be able to do this on is something like grass or rubber gym flooring. So once you find something that'll slide, you're going to put the involved side or the knee that hurts, that foot's going to go on the slider. So in this case, my left leg hurts, so I'm putting my left foot on the slider. And we're just going to go through a slider lunge, so a lateral lunge where I'm sliding my foot out and pulling back in. The majority of the weight's going to be on my standing foot, but what I want you to think of as you're sliding that foot back in is imagining you're on a beach and you're trying to dig a bunch of sand up as you're sliding that foot back towards your midline. So not just keeping hardly any weight on the foot and sliding it back and forth, but as you're pulling in, I'm thinking of pressing my foot into the ground, trying to drag a bunch of sand with me as I pull back in. Way we can make this one a little bit more challenging, find something to fasten a band to. So I'm just using my sled. We can put that band around our ankle just like we did for the first exercise. And now we're going to go through the same movement. Now I'm just getting a little bit more challenge of using my adductor on this sliding side as I pull back in. I would do this on both sides because as I'm moving my left leg, I'm working through a bigger range of motion with that adductor. When I slide on my right leg, now my adductors on that involved side are acting more like stabilizer muscles. So that would be a little bit helpful to train if you're experiencing that medial knee pain with something like lunging or squatting. So always good to do this on both sides where I can train the shortening and lengthening of that adductor muscle, but then also the stabilizing aspect of that muscle as I'm sliding on my opposite foot. So those are just a few exercises that you can try if you are someone experiencing some medial knee pain. Of course, there are other potential contributors to medial knee pain like the meniscus, the MCL, and sometimes even the joint surface itself. But I think often overlooked is the potential that the pes anserine is contributing to that inside knee pain. So you get the three tendons, the gracilis, the sartorius, and the semitendinosus, all running to form a tendon right on the inside of the knee. It's very possible that you're having more of like a tendinopathy or even like a bursa issue instead of some of those other static structures. So when it comes to knee rehab, quads are king. If you're not loading your quads, you're missing out. But we don't want to focus solely on the quads, especially in that inside knee pain scenario where the pes anserine could be contributing to that. This is a diagnosis that is a little bit of trial and error where you're not really certain that that's what's going on until you start responding favorably to it. But nonetheless, it's good to work on different planes and some of these supporting muscles when you're trying to rehab a knee. So these are just a few examples of that. Any exercise where you're going to load the hip adductors, the hip extensors, and the hamstrings are likely going to help that pes anserine. So just use these as an example. If you've never heard of the pes anserine, you're welcome. It's not really that commonly thought of as a structure contributing to knee pain, but it absolutely can. So I hope you guys found this video very helpful, especially if you're out there dealing with some inside knee pain with lunging, squatting, deadlifting, and all other sorts of things. If you have any questions, leave them in the comments below. If you found this helpful, please like this video and subscribe to our channel, and I'll see you guys in the next video.